Patients come see me, they just say, I feel like I've aged overnight, or I feel like, I suddenly look exhausted, I look angry all the time, I look tired all the time. It's not how I feel. So I'll just examine their whole face and do kind of a detailed analysis and let them know kind of what are the things that are contributing to that look. So a lot of the time someone will come in and say, I feel like I look tired all the time and I don't like my nasolabial folds. Can you feel this? And yes, I can feel the nasolabial folds, but that's not necessarily going to make them look less tired. So it's more helpful for me for someone to come in and just say, like, I feel like this. I feel like I look this way in general. And then I can look at them and say, well, this is what's contributing to that appearance. And those tend to be pretty standard things. Young people come in and they're like, I want to just be a prettier version of myself, kind of that celebrity plastic surgery where the befores and afters, you can't tell what was done, but something was done and they just look prettier. My favorite procedures in cosmetic surgery, aesthetic surgery are anything to do with like here up, basically the chest up. So I love facial surgery, I love facial aesthetics, I love facial anatomy. To me, it's very detailed, it's very meticulous. Little millimeters can make a huge difference. Putting volume in one place or eliminating a shadow from another place can really rejuvenate a look, and I find the work challenging and interesting, and everyone's different. So I just love operating on the face or doing injectables on the face or making sure someone's skin is bright and youthful. And then as far as the body goes, I love doing mastopexy augmentation, so lifting the breast and augmenting it with an implant as well. I think it can give such a beautiful result. It can really rejuvenate the breast area, and I really try to make everything as beautiful and shapely as possible. A lot of patients who come in and they say, I went to the surgeon and they didn't really listen to me, and I just wasn't comfortable, and I want my patients to feel comfortable. Like whatever it is, you can talk about it, you can tell me, you don't have to be shy, you don't have to be embarrassed. So many people come in for like labiaplasty, for example. They're like, I have this thing that, it kind of bothers me. I'm like, it's fine. It's totally fine. We can talk about it. It's okay. So I just want them to feel comfortable. So a little bit about me personally. I am Iranian American. My parents immigrated here in the late 70s, early 80s. I have an older sister. She's amazing. We're best friends. She's an attorney. She's living out in LA with her husband and her baby. It's really helpful to be able to connect to people quickly. And I think my work experience, and I've had a job since I was 14, really helped with that. I was raised by a single mom, and she raised me and my sister, and we both obviously did well and in school and in life, and I think our mom's pretty proud of us. My husband, we met in St. Louis, and he's also a plastic surgeon, and he's on the reconstructive side. I'm fully cosmetic, so we do share a lot of our cases and go through kind of complex problems and things like that. And I met him when I was a resident, so it was really nice to be married to an attending. I get a lot of people with a little bit of plastic surgery guilt, like there's something that's been bothering them forever. And in the office, they made it all the way to my office, and still they're sitting there being like, I don't know, maybe it's too much, like, am I vain? I'm like, no, you're not vain. It's fine. Just fix it, move on. It'll give you freedom. You don't have to think about it anymore. And you just get on with your life and enjoy it. It's really important to feel good about the way you look. And I think that it really makes a difference in the way that you interact with the world. Like, I know that on days where I don't feel pretty or I don't feel put together, that I just don't feel as good. And I don't do as well, and I don't feel as confident, and I don't, sit with my shoulders back and my chin up type of thing. And I think it's really meaningful work to be able to give that to someone.